Meet John Doe, your local family physician. He meets with you as well as many other patients to continuously address your health concerns and ensure that all patients are as healthy as they can be. While it's rewarding, this job is very demanding, as the health of John's patients partially relies on him. But despite his passion for this career, John feels mentally exhausted when it comes to work. He doesn't feel as excited to come into the office as he once did, and is overall less efficient when it comes to his job. One possible reason is burnout. What exactly is burnout? Burnout is a phenomenon that is brought on specifically by work stress according to the International Classification of Diseases that is not managed effectively. Some common symptoms include feeling physically and emotionally exhausted, frequent headaches and muscle pain, experiencing distant and negative feelings towards your job, feelings of failure, self-isolation, and having reduced efficiency in your career. It can be common for physicians to feel burnout symptoms at some point in their career due to various potential factors. Work-related factors specifically include feeling little control over work, experiencing demanding job expectations, and working in high-pressure or chaotic environments. Your lifestyle also has a significant impact, such as not getting enough sleep, not having strong support systems, and working long hours that minimize social connection. Dr. David Chan is here to discuss his experiences as a physician.
Hello, my name is Dr. David Chan. I'm a professor emeritus. That meant I was a professor at McMaster University in the Department of Family Medicine. I retired in 2016. Since then, I continue to work, but I choose a focus on the care of the elderly, so nursing home, retirement home. And now, most recently, for the last several months, I've been a physician in uh, a local hospice.
What was your experience with your workload throughout your overall career as a physician?
I was a faculty doctor, so I run a practice of about 1,000 patients. I look after these patients with the help of residents and medical students. I spend roughly 2 to 3 half days on my own seeing patients, and the other times I supervise the learners. And on top of that, I started my academic career delivering babies and looking after a nursing home and became a medical director of a nursing home. So all of that, make my workload rather high. At one time we were asked to clock our workload, and it came to 80 hours a week. So and now I just do PCU work at the hospice, and I look after some retirement home patients.
Did you face any burnout in medical school? If not, how did you ensure that you didn't experience any of the symptoms?
I entered medical school as a mature student. I went back to medical school for a very specific purpose. I wanted to become a missionary doctor. So it helped me. Number one, I was more mature in the sense that I know what is important, what is not so important. I learned to balance my life by swimming, by being involved in other campus work, which gave me a focus, and to continue to use all my elective time to prepare myself for what I felt was the meaning of going back to medical school. So I didn't really have a hit burnout experience.
Your daughter and fellow physician Joan Chan is doing incredible work to raise awareness and provide coaching for physicians that may be feeling symptoms of burnout. Her restorative medical education and coaching is making a large impact on the mental health of our medical professionals. Why is this work so crucial, and how could this have benefited you?
Obviously, my daughter's work is geared towards those who recognize themselves being at risk, and if you don't sit back every so often, like getting into a habit of asking, "Am I working towards my goal? Do I need help?" Those who find help would find some of these specific training very, very helpful. Now, for me, I have always had really rich resources of groups that I belong to. I can always, go back and bounce off my struggles, and then often I get a lot of help. And then you adjust your workload.
What are some important methods that you implement to ensure that you maintain the crucial work life balance and help your overall mental health when work becomes overwhelming?
Well, for me, my graduate school training in evidence-based medicine, or in McMaster, which is world famous for the clinical epidemiology department, I learned the most important part about clinical practice is that on one hand you develop clinical expertise, but you really have to look at the evidence, whether they're robust or not yet. because you in your practice, you'll be overwhelmed with all guidelines and people's opinion. Okay. Whereas if you don't feel certain about what you know or what you don't know, and then how to find out, then it's a setup for a very, very stressful career. And then lastly, the importance of patient's preference to really learn how to communicate a full patient consent. Uh, then the burden is not necessarily all on you. When patients understand, then they wisely choose what they choose, right? And the importance of my faith journey, strong family support, and lastly, it's never too late to run a marathon.
So, like Dr. Chan, what can you do to avoid burnout in your career? You can establish important boundaries to nurture your mental and physical well being. As well, reach out to your loved ones, build community connection, take time to rest, and try to avoid self isolation. Addressing physician burnout is a vital step in caring for society's overall well being. It's time to return the favor and care for our physicians' health to create a more sustainable future for healthcare professionals and therefore the patients they serve.